President, Chairman of the session. First and foremost, I would like to thank you all for being in attendance as well as for your valuable time. I would also like to express my most sincere gratitude to Mr. Casio for organizing this conference and the opportunity to present here today. Our research on the topic being discussed today initiated approximately 4 years ago. I'm an otolaryngologist, head and neck surgeon, and it's the cancer of head and neck is the worst cancer of the body. And about 4 years ago, as a continuation of an ongoing study on the cancer of the head and neck surgery, with the photodynamic therapy and use a photodynamic therapy for this cancer, which was first conduction 15 years ago at the Iran University of Medical Science. One of my most trusted friend and colleagues, Dr. Ali Shakerizadeh, is a nanotechnologist and biophysicist, accompanied me and my team and I in conducting this study. Thank you. My study is a new protocol for photothermal therapy of cancer using folate conjugated gold nanoparticle. And the most common disadvantage of The most common disadvantage of phototherapy is non-selectivity and lack of stability for conventional photosynthesizers at bleaching of the photosynthesizers and requirement of high power density of laser and its hazard of the normal cell to laser and high voltage of the laser for the cell. A need existed to target cancer treatments specifically to the tumor side without damaging healthy tissue. The answer to solving this challenge lies in the successful application of nanotechnology to cancer treatment. Nanotechnology is based on the 1 to 100 nanometer scale, as its name is implied. A malignant cancer is typically fast-growing, which means that it's required more nutrients and increased vast removal than healthy tissue. And nanoparticles injected into the bloodstream can enter into the tumors because of the defect or pores within the tumor vasculature. However, the residence time within the tumor is limited due to random diffuse into and out of the tumor. Therefore, increasing the residence time of the nanotechnology-based cancer treatments within tumors is necessary. To achieve increasing residence time, active targeting must be used. Active targeting is based on the selectivity targeting cancer cell through a specific binding site on the surface of the cell, such as the receptor. Various methods of the targeting cancer cells have been proposed. One promising targeting method is with folic acid or folate, the folic acid salt, which is the subject to the present report. Cancer cells tend to overexpress the folate receptor because of their vast requirement for folate. It has been proposed that the folate receptor makes for suitable targeting agent because of its relative low expression level in healthy tissue and overexpression in cancerous tissue, especially in KB cell at the nasopharynx. A positive aspect of the folate is its possible conjugation with a number of nanotechnology platforms such as gold nanoparticle and chemotherapeutic agent. When this nanotechnology platform are deposited at the tumor site, a variety of methods to eradicate the cancer cell can be used, such as thermal ablation, drug release or delivery, or even coated the cancer cells with a high affinity antigen, which the body's immune system can detect and mount a defense against. At the figure, the non-conjugated is internalized by the folate receptor in an endocytotic pathway, which does not enter into the keratin-coated PET pathway. This means that the nanoconjugated is released directly into the cytosol rather than being transported to the endosome or lysosome by intracellular vascular report. Herein, the current study demonstrated the selectivity, targeting, and distraction of human nasopharynx cancer. KB cells, it's perfect for a nasopharynx cancer cell. Using the photothermal therapy of the folate conjugated gold nanoparticle, considering the beneficial characteristics of the GNPs and an overexpress of the folate receptor by KB cells, we selected FGNPs as a targeted photothermal therapy agent. Method and materials for this research is figured about our schemes for the synthetic procedure of the nanoconjugate are shown. The final product of this synthesis are folate AUMP nanoconjugate in powder form. For characterization of nanoconjugate, the following tests are performed: and UV visible absorption spectroscopy, for transmission infrared measurement, and transmission electron microscopy used for these nanoparticles. When the cell reached more than 85% confluence, they were washed with trypsin EDTA solution for 5 min at 37 centigrade to remove adherent cell from the culture flask surface. Cells were then resuspended in media centrifuge at 1,200, and the cells were counted through staining with the trypsin blue to ensure viability. Nanoconjugated at different concentration, dispersed in the deionized water, were incubation in flat bottom 96 well plate with the density of 5,000 cells per well for different incubation period. The same density of cell were considered without non-conjugated as the control groups. For statistical analysis, we use SPSS package for Windows and Microsoft Office Excel and Kolmogorov-Smirnov test and ANOVA test. And result of what?
You want to change the slide?
Oh, okay.
Yeah.
The absorption maximum at 218 and the saddle point at 360 nanometer are confirmation of the covalent attachment of the folate with AuNPS. The absorption peak at 560 nanometer pertain to AuNP. Figured is the transmission electron microscope TEM micrograph of the synthesis nanoconjugated and their size histogram. According to this figure, the shape of nanoparticles is quite spherical, and the size histogram indicated the formation of nearly monodispersed nanoparticle with an average diameter of 48 nanometer. We investigated the cytotoxicity of nanoconjugated on KB cell line at the various concentration ranging from 1 to 100 micromole and for different incubation period of 6, 12, and 24 hours. We investigated the role of two factors on photothermal treatment of cell. One, the effect of the dosage of nanoconjugated on photothermal treatment, and two, the effect of incubation period of cell with non-conjugated. The most significant start of cell death due to PTT, photothermal therapy, at a mean of non-conjugated concentration occur after 6 hour incubation and at 10 micromole non-conjugated concentration. It's a start of the cytotoxic effect of PTT and nanoparticle effect. It's after 12 hours, and it's after 24 hours. It's a high toxicity of the PTT and nanoparticle at the cell. Generally, to reach a higher level of cell death, a longer incubation time is preferred over using higher concentration of non-conjugated particle. Synthesis and application of new folate conjugate gold nanoparticles, as we reported this. In conclusion, we reported synthesis and application of new folate conjugated gold nanoparticle because this new synthesized complex non-conjugated material, folate AuNP, contain folate. It can be applied to selective targeting of folate receptor positive cancerous cell which overexpress folate receptor on their surface like KB cells. The experimental results have led to the following conclusion. Gold nanoparticles can be heated up to the desired temperature level through exposure to laser according to the procedure introduced in this report. Results from our study show that the non-conjugate concentration play an important role in the photothermal cell destruction. Our findings show the process of the non-conjugated entering into the cell is strongly time-dependent, and damage of more than 90% for KB cell was achieved. I would like to take a moment to express my appreciation and acknowledge Dr. Shakerizadeh and everyone's hard work, ongoing involvement, and determining in seeing this project through. But unfortunately, due to difficulty with acquiring a visitor visa for Dr. Shakerizadeh, is unable to be in attendance today. And I do another project for this tumor for future time. This is new therapeutic avenue for cancer therapy MERS for the investigation using in vivo model for application in humans. I'm very honored to be both presenting for and in the presence of such a profound group of elite intellectuals. Thank you all once again.